Dr. Nyikal, picking up from that point, I mean, at what point do you then think there's going to be a convergence of consensus with regards to, yes, there's this plan by the government, which is challenged in court. It's essential in the sense that healthcare, despite being driven by the current government, is for the future. I mean, it's meant to cater for all Kenyans. How then do you think there can be the arrival at the point of convergence of seeing what's good in this healthcare plan that the president has built it as the antidote to our problems?
First of all, let me remove one thing.
Yeah.
The matter in court, in my view, does not affect the basics of improving health system. Yeah. They have just a small bit on one act. And I think there is politics trying to make it look like this is why we are not getting there. They are cheating. What needs to be improved is the health infrastructure. It's simple. To treat somebody, let's take level 2. Mm-hmm. If you go to level 2 with just some headache, which could be malaria, what do you need there? There's the building, and the desk you sit on, and the laboratory there, and the drugs there, and a person there. That is the basic thing that you need. So when you have that, then that is working. Now we are talking of this social health insurance as if it is the only money that is now being used in the health sector. What about the money that comes from the budget? We should use that while that one is stuck to actually improve this so that we can start. So the matter of court case interfering with the UHC progress, we were joking. We have enough in our hands to do. So the convergence will come when we realize, and I don't know, it's real, there are people there who can do it in that ministry. I think that politics is outweighing service, the concern for politics outweighing service. You have to look at what are the human resource. What does this kid in court do with the human resource? He has gone in length and explained to you everything. He's left, and there's something which I can add. Yeah. The people, the training of health workers, if you take the examples of doctors, the issue of registrars, you know, when they are training in Kenyatta, they're actually the workforce, but the counties have been paying them. Now they're looking at that. Now they don't even want to say. So the human resource, that is one. Supplies. Now you've talked of KEMSA. So KEMSA is a main supplier, but it has to be paid when the money has come. The social health insurance money will just supplement what is in the budget. So when we are waiting for that, we go to the budget. Now, the money we are talking about, the NHIF, that I think we have enough to improve. So it will work when we look at the various components of the health systems and start to address them and see how they link together, so that you don't take one bit and keep hamming it. You see, now it is this insurance thing. We're hamming it. We're not looking at everything. Now, when my colleague here and his team go on strike, we forget that one. Now we go on the issue of human resource, hamming it, and not doing anything. So we must see this as a composite, which must all be addressed together, bit by bit. Then it will work. Two, I want to say this very boldly, and I know what my friend here will say, the conclusion I've come to. The Minister of Health is not sincere.
Yes.
The problem in KEMSA is from the Ministry of Health. It's not in KEMSA itself.
What are the reasons?
I'm going to tell you. The problem in HSF is from the ministry itself. Although there are problems there, but the ministry's interference in there. These are institutions, even if we put this authority, that must be left to run with their infrastructure. The ministry must watch back and be very careful and monitor, and only come in when when they come in, how do they come in? There is, let's take KEMSA. KEMSA has a board. KEMSA has to allocate its money. KEMSA should procure. The process of procurement at KEMSA should be purely a KEMSA thing with the board members and the technical people in KEMSA. How does it come that when there is a problem, let's say the procuring of nets, then you hear that something came from the ministry that changed the procurement process in KEMSA? It should have been just technical advice and left to KEMSA to do what to do. When they appoint the board, they don't let the board free. And when it's the same thing, even if we get this authority, if it's not left. So my view is the ministry has to be sincere, look at the structures, appoint competent people in these areas, and let those competent people work.
Yeah, and then how do you then speak about, even as you talk about the certain degree of autonomy which these institutions or agencies of government have within the Ministry of Health, when it comes to the question of corruption, because we had seen even procurement processes that were not adhered to, and lifting the lid on what's apparently appearing to be an in-house sort of crisis in the management of the drug supply agency, which is a critical component, as you have mentioned, in this whole debate about the healthcare plan.
Now, you see, when we look at these things, first of all, what I want to do normally is even now not to look at the Kenya Kwanza government. I want to look at the history back. Because that's
actually the point.
Yeah. So this
with KEMSA, even in the previous government.
Yeah. So this is, we should look at what is the common factor in all this. The common factor is basically interference from the ministry within these institutions. So that when it is procurement, let them do the procurement. When they caught up in corruption, let them now deal with the issue of corruption, not so that the ministry does not come in. So that is that, because I know that because I was there. KEMSA was a medical stores. Then we changed it to a medical supply agency, which gave it the mandate of procurement and storing and distributing, which means they got some money. Yes. So that, let me tell you, when it was a store, procurement was being done by the ministry. Drugs were just being taken to KEMSA as a store. But now when the supply agency is also doing the procurement. But procurement itself, you know, is the most lucrative thing in governance. It is the route through which money leaves government coffers and gets into people's hands. So it is always a deal. So I don't know. I'm just thinking, why can't they let that happen and so? So your question is this.
Yeah.
Corruption is everywhere in this country. But let every agency be found to deal with its own corruption. The ministry should come as oversight board. Remember when we had the issue of COVID, that the CEO that was actually, I think he went off, he was sent off. You remember one time in the health committee said in the view of the public that there were phone calls and SMS messages that were coming from the ministry telling him what to do. Even the recent one, when it was net, there was an issue that some instruction came from the ministry. And it is coming to an institution which has its own board.